Professor, what is the main idea you developed in your conference today?
I think the big message here is that the big damaging disease that we're facing with metabolic syndrome is type 2 diabetes, and that disease process of type 2 diabetes is in fact the same disease process. It is part of obesity. It's part of one disease process of fat accumulation, and that fat can be excessive in amount but also abnormal in its distribution. And so the treatment, management of type 2 diabetes, and indeed prevention of type 2 diabetes, is exactly the same as the treatment, management, prevention of weight gain and obesity.
How would you describe the scientific holding of this event? Scientific level of this event?
The science behind this is really overwhelming now, and that comes from observational studies over many years in many populations which have looked at the development of metabolic syndrome over time with weight gain, and it's inescapable that this disease is caused by weight gain. And there's now inescapable 100% positive evidence that weight loss, it has to be fairly substantial weight loss, at least 10 kilograms, ideally in many cases 15 or even 20 kilograms, will reverse that disease process and reverse its clinical consequences. So the clinical complications of diabetes, the ghastly disabling consequences of diabetes, will be reversed if we can achieve sufficient weight loss, and it depends on removing ectopic fat which is abnormal, which should not be in the vital organs, in the liver, in the pancreas, in the heart. And these occur at the same time, perhaps slightly different rates, but the weight loss of 10–15% will remove that ectopic fat and remove the clinical consequences from the disease.
What are the fundamental reasons for what you participate to this event? Why are you there?
Well, why I've spent many years conducting research, looking after my patients in clinics, in the hospitals, and indeed in primary care, is because I see type 2 diabetes destroying families, destroying lives through its complications, often unrecognized. The disease itself may be undiagnosed, and then the complications develop without symptoms at an early stage, and they become permanent and permanently damaging, as well as shortening lives. So we're seeing individual lives ruined by it, families ruined by it, and then across the world we're now seeing communities damaged, severely damaged by diabetes. And we're thinking particularly here of lower income countries where with indigenous people and people who are now living in the big urban sprawls around big cities, who've migrated from the countryside. These are people who gain weight during one lifetime, which has never been seen in their populations before. They're developing diabetes rates of 20, 25, 30%, and this is doing terrible damage to communities. So my passion is to be able to help individual patients, and of course by virtue of improving their health, the well-being of their families. And I'm now particularly interested in taking this into the communities in Aboriginal communities in Australia, communities in Asia, where we're seeing big damage to families and communities, and to be able to try to equip people and those communities themselves to be able to tackle diabetes, perhaps without input from doctors and nurses, but by manipulating the diet provision and the lifestyles of those populations.